People really need doctors. Patients really need us.
It's time to step up to the plate. That time is now.
This is an unprecedented time in medicine in the last 100 years.
You hear stories about young physicians and nurses getting sick and critically ill and even dying. So it's easy to sort of watch what's going on and get tremendously depressed and scared. There's sort of that selfish, primitive portion of the brain that says, I just kind of want to curl up in a ball and not go out and do this. And then that rational side kicks in and reminds you that this was why you chose medicine. This is your calling. The time is now.
I am asking healthcare professionals across the country, if you don't have a healthcare crisis in your community, please come help us in New York now.
NYU announced that it was graduating their class early. Of course, New York City is about 2 weeks ahead of us. We would anticipate that we would be peaking in April, just about the time that these students would be graduating, and therefore we may very well need their services as quickly as possible. During World War II, several medical school classes graduated in fewer than 4 years. And for the same public health reasons, the government wanted to get physicians to take care of the troops earlier.
Won't you join the American Red Cross and become one of these merciful workers?
The soldiers in this fight are our healthcare professionals.
To hear like the governor and especially to hear our dean say like, you're ready and we need you is a real representation of how serious things are. If there wasn't such a lack of PPE, there wouldn't be the need to call in all these people early. If we were able to protect the current providers as best as we normally can, then doctors and nurses wouldn't be getting sick, then they wouldn't be out of work, and then we wouldn't really probably be needing to bring in all these people early.
Sometimes when I'm sitting here and trying to focus on my schoolwork, sometimes it makes me a little upset because I'd kind of like to be there too. And if they let us sign a waiver right now to allow us to help out in hospitals, I think a lot of us would. I know I would.